Ontogeny, the life cycle of a organism, when we tell in terms of the development, then it is called as ontogeny. Development of human beings, usually it is considered prenatal period, postnatal period. The development or the growth of the human being is a continuous process. Prenatal period, it is again divided into pre-implantation or pre-embryonic development, embryonic period, and fetal period. Coming to the pre-implantation or pre-embryonic period, that is in the first 2 weeks of the development. After the fertilization, starting from the two-celled or single-celled zygote till the embryo formation, that is first 2 weeks. It is called pre-implantation or pre-embryonic period. Coming to the embryonic, that is from the 3rd week of gestation till the 8th week after fertilization. That is called embryonic. And fetal period, after 8 weeks till 9 months till delivery, it is called as fetal period. First 2 weeks fertilization. The pre-implantation or pre-embryonic period includes fertilization, cleavage, transportation of the cleaving zygote from the fallopian tubes till for the uterine cavity, then blastocyst, implantation, specialization of the primordial embryonic tissue into embryoblast and trophoblast, differentiation of the embryoblast into bilaminar germ disc, differentiation of the trophoblast into cytotrophoblast and syncytiotrophoblast. Fertilization takes place in the fallopian tube at around immediately after the release of the ovum or the sperm. When fertilization takes place in the fallopian tube, there the zygote is formed. Then the zygote travels through the uterine tube with the ciliary action or the peristaltic movements of the fallopian tube and enter into the uterine cavity. In the uterine cavity, few changes take place and embryo is implanted into the uterine cavity. After the implantation, the development of the zygote into embryo takes place. Then embryonic period from 3rd week to the 8th week. Trilaminar germ disc differentiation, early organogenesis, formation of extra embryonic supportive organs and membranes. Fetal period is from 9th week to 9th month, where growth and specialization of the organs takes place. Importance of embryology in medical profession. When we know the normal development of the embryo, then we can see whether or we can intervene if there are any abnormalities. Only when if we know the normal development. And normal adult anatomy. This when we know the normal adult anatomy or the development, then abnormalities in the organ systems or the abnormalities in the development can be seen, and any interventions required can be done prior to the priorly, or it can be done in the later pregnancies also. Understanding the postnatal and adulthood diseases. Fetal programming of adult diseases. This is called fetal programming of adult diseases because the embryology not only requires the growth. When it requires the growth, there are so many biological and cellular processes takes place, so which result in the diseases, development of diseases or development of abnormalities. Healthcare strategies for better reproductive outcome, therapeutic procedures for infertility, fertility related problems, and stem cell therapy. Once if we know that proper fertilization or the proper implantation, then we can reduce the infertility or fertility related problems. Also newer branch stem cell therapy, where we can take the embryonic stem cells therapy or the adult stem cell therapy also is there. Week 1, fertilization to implantation. Brief note on the folliculogenesis. Once the ovum is released from the primary oocyte covered by single layer of follicular cells, this development occurs in the intraembryonic period of a female, formed during the intraembryonic life at around 10th week of development. This further division arrested until the puberty due to oocyte maturation inhibiting factors. There are around 2 lakhs in each ovary at birth. of primary oocytes. Then they reduce due to apoptosis or programmed cell death, or few cells degenerate and form 40,000 cells at puberty. In them, only 400 to 450 mature during the reproductive life of a female. First meiotic division takes place at puberty under the influence of pituitary gonadotropins. Then secondary multilaminar, this after the division, the oocyte remains in the first meiotic division. It is arrested in the second phase of the second meiotic division. Secondary multilaminar follicle is formed by the cells of the surrounding ovarian tissue, stratum granulosum cells, and follicular cells now called the granulosa cells. Preantral follicle, the fluid present from the ovarian tissue enters into the follicle, and few fluid filled spaces are formed into the inside the follicle. This is called preantral follicle. Then fluid filled spaces coalesce to form the follicular antrum called the antral follicle. Then mature or Graafian follicle, next slide. Mature or Graafian follicles is developed. In this, the primary oocyte is present at the center. Then few glycoproteins are secreted by the surrounding granulosa cells, forming the zona pellucida. Then few cells of the granulosa tissue radiate from the primary oocyte to form the corona radiata cells, and this structure with the antrum is attached to one side of the Graafian follicle by the cumulus of zonal cells. Few cells surrounding the primary oocyte are called cumulus ophorus. It is surrounded by the thecal cells. Few cells differentiate, get flattened, and surrounding the forming Graafian follicle called the theca interna cells. Primary oocyte completes its first meiotic division and forms the secondary oocyte and first polar body. At this stage, the ovulation takes place. While during ovulation, the primary oocyte along with few cells of the corona radiata cells and first polar body are ejected or pushed out from the ovarian tissue. Here, the meiosis II begins, but it is arrested in the metaphase II stage. While coming to the sperms, I am not going into detail of the spermatogenesis, but maturation of sperms in the male genital tract takes place, where the sperms acquire the capacity to motility. This motility is of little importance. Then after coming into the female genital tract, they acquire maturity and motility. This maturation, the last step of maturation, is called capacitation. Once the sperms, by knowing the time of ovulation or the sperms and the time of length required for the sperms to travel through the uterine cavity or fertilization, we can detect the time of ovulation, and semen analysis can be done, and thus can help in fertility related problems. Fertilization, a signal for completion of after fertilization, the second meiotic division is completed. Transport of ovum from the intraembryonic peritoneal cavity into the fallopian tube, and the sperm from the female genital tract till the fallopian tube takes place. Then contact and fusion of gametes takes place. Once the sperm is released into the sperm comes in contact with the ovum, then it has to penetrate through three barriers, that is corona radiata, zona pellucida, and the vitelline membrane surrounding the oocyte. This penetration of barriers takes place by the acrosomal reaction. Acrosome contains few enzymes such as hyaluronidase, then proteolytic enzymes, then acrosin. This hyaluronidase rupture is released once it comes in contact, and the corona radiata cells are disintegrated. Once it comes into the zonal area, zona pellucida, then the proteolytic enzymes are released. Also, it is again facilitated by the zonal glycoprotein receptors present over the zona pellucida and the acrosome released. P2 and ZP3 receptors are present over the zona. Then the proteolytic enzyme disintegrates the zona pellucida layer. Once the once the sperm touches the vitelline membrane, the acrosin enzyme disintegrates the vitelline membrane. Thus, after the entry of the male pronucleus is entered into the oocyte. Once the male pronucleus enters into the oocyte, there are sufficient calcium influx takes place into the oocyte. Then the cytoplasmic changes takes place, so that the zona pellucida or the vitelline membrane stop the fusion of the other sperms. Nuclear fusion, the male pronuclei and female pronuclei fuse together to form the zygote. The haploid sperm and the haploid ovum fuse to form the diploid zygote. So, as a result of fertilization, restoration of diploid number of chromosomes takes place, determination of the chromosomal sex, initiation of the cleavage. The two daughter cells are still surrounded by the zona pellucida cell layer. The factors influencing the fertilization are like normal anatomical anatomy of the reproductive organs, chemotaxis, and the time interval between the insemination or the ovulation, time required for the sperm to travel through the uterine canal, and the time with length of the time the ovum is ready for fertilization, and the length of the time the sperm is having the capacity to fertilize. These are the factors which influence the fertilization. After fertilization, the zygote travels through the uterine fallopian tube, and it's implanted into comes into the uterine cavity where it gets implanted. Repeated mitotic divisions within the zona pellucida which give rise to smaller cells called the blastomeres. This lasts for 6 days, that is up to 7th day after fertilization. Then at 7th day the implantation takes place. Subdivision of cleavage, the stage of compaction, the cells of the zygote, they get compacted and they form the inner cells and the outer layer of the cells. Inner cells have tight junctions, whereas the outer cells have gap junctions which are closely compacted. Then 16 cell stage called the morula, which forms on the 3rd day at 3rd division. Then blastocyst, which is 32 to 64 cell stage. Morula 16 the zona pellucida is still present. The inner cell mass, which is called the embryoblast, surrounded by an outer cell layer which is called trophoblast. The blastocyst between 4th to 5th day, that is 32 to 64 cell stage. Fluid from the uterine cavity comes into the blastocyst, and a cavity is formed called as blastocyst cavity. Morula is this inner cell mass is partially separated from the outer layer. Then the inner cell mass is attached to one end of the outer layer inside the trophoblast. The site of attachment of the trophoblast is called as embryonic pole animal pole or embryonic pole. The other end, opposite end, is called the abembryonic pole. Polar trophoblast and mural trophoblast. The trophoblast which comes into contact with the endometrium where the blastocyst is embryoblast is attached is called polar trophoblast, and the remaining trophoblast is called mural trophoblast. This is cleavage, 4 cell in the 8 cell stage, 16 cell stage later on, which is called the morula. Then the cells are rearranged as outer flattened cells called the trophoblast and inner embryoblast, which is attached to one side of the trophoblast, and a blastocele is formed. After on the 5th to 6th day, the zona pellucida disintegrates, becomes thinned due to proteolytic enzymes. After thinning on the 6th day, the zona pellucida disappears. Once the blastocyst is hatched from the zona pellucida layer, the trophoblast cells have the tendency to stick to any organ or any surface when they come in contact with. So this initiates the implantation on 7th fertilization day. The process of attachment and invasion of the blastocyst into the uterine cavity between 6th and 12th days. The part of the trophoblast making contact with endometrium is called polar trophoblast, and the remaining is called neural trophoblast. Decidual reaction takes place, changes in the uterine endometrium. The decidua, the site of attachment of the blastocyst, the decidual reaction, with the decidual reaction, the decidua is differentiated into three parts. That is decidua basalis, where the implantation takes place, decidua capsularis. Once the implantation, the blastocyst enters the endometrial cavity, endometrium, the cap-like structure formed around the blastocyst is called decidua capsularis, and the remaining decidua is called decidua parietalis. Hatching of blastocyst takes place, addition of the polar trophoblast to the columnar uterine epithelium, then penetration of the blastocyst through the uterine epithelium. Erosion of the uterine endometrium and the spiral arteries or the uterine arterioles become enlarged spiral, and they form sinusoids. So the blood transport or the blood circulation takes place easily for the developing embryo. Differentiation of the trophoblast as cellular trophoblast, another layer, a single layer, now it is another layer is formed around the cellular trophoblast. With the loss of cell membrane, it is called syncytial trophoblast or plasmodial layer. The closure of penetration defect in the uterine epithelium, the implantation lasts from 7th day till 12th day. Once till 12th day, the implantation is completed and the blastocyst is completely embedded into the endometrium. So that gap where it is present, it is closed by fibrin plug. The completion of embedding, the establishment and of nutritive relationship with maternal blood vessels on 12th day. The syncytial trophoblast erode the maternal capillaries, results in sinusoid formation. Several lacunae are formed inside the syncytial trophoblast, increases in size and becomes continuous with the maternal sinusoids. In this week 2, where the embryo is formed, the week 2 abnormalities may be like abnormal implantation or high datidiform mole. Abnormal implantation when the that is called as ectopic pregnancy. Then high datidiform mole, once the sperm fertilizes with the egg which doesn't have the nucleus, then only the haploid number of chromosomes are present in the fertilized product. This forms only complete mole, that is only trophoblastic proliferation will be there without any embryonic formation. Complete mole has haploid sperm and egg with absent female pronucleus. The tissue whichever is formed contains only haploid number of chromosomes. This usually prolongs till 16th to 18th week of pregnancy. Only then the symptoms will be seen in the patient. There will be elevated HCG levels and the urine pregnancy test comes positive. Only by ultrasonography or imaging study the molar pregnancy can be identified. Coming to partial mole, this normal egg can be fertilized with 1 or 2 sperms and this triploidy. Sometimes embryo is formed and the fetus is developed, but the fetus developed will be very abnormal along with the formation of molar pregnancy. Also there may be persistent gestational trophoblastic tumor in some cases. Normal site of implantation is upper part of the body of the uterus in mid sagittal plane. either posterior, which is more common than the anterior. Abnormal sites may include in the uterine cavity, cornual, or in the placenta when the implantation occurs in the uterine cavity at the site other than the normal site, then that may result in placenta previa, like in lower segment. The placenta previa, dependingly, it is again divided into three types, two types majorly, complete or partial placenta previa. Extrauterine implantation may take place in tubal, which is more common, and depending upon the incidence, interstitial more common than the ampullary and the isthmus region. Abdominal implantation is always secondary to the ruptured tubal pregnancy. Primary abdominal implantation is very rare, and some cases we can see in ovarian implantation also. By knowing the ovulation or the spermatogenesis and everything, when studying the uterine cavity decidua, it is very helpful in assisted reproductive technique like in vitro fertilization. In this, the ovary is stimulated to produce one or more ova by gonadotropins or clomiphene citrate. The ova are aspirated from the Graafian follicle. Then these aspirated ova are cultured in the medium. That's why it is in vitro. Collection of sperms and preparation of sperms, these are incubated in one medium. The female and male pronuclei unite. This results in 8-cell stage morula. This morula is implanted into the female genital tract. Coming to multiple births, that is the cleavage site. If the sometimes two ova may be released at the same time. If two ova are fertilized with two sperms, then it is called dizygotic twins or fraternal twins. Sometimes a single ovum fertilized with a sperm may undergo cleavage to form monozygotic twins. In this, the genetic composition is different for both the babies in dizygotic twins, but in monozygotic twins, since they have arisen from a single embryo zygote, it is identical genetic constitution. They need not be of same sex, they may be of same or different sex in dizygotic, whereas in monozygotic they are of same sex. They do not resemble each other any more than the children of the same parents when they are born separately, but in monozygotic they are identical in each and every way, including the HLA genes. In dizygotic, 2 amnions, 2 chorions and 2 placentae are there. Monozygotic, depending upon the time of cleavage, they may be diamniotic or monoamniotic, or in a single Siamese twins like conjoined twins. So depending upon the day where the cleavage takes place, if it is it happens in morula, since the inner cell can give rise to, each cell in the inner cell can give rise to a single embryo, whole embryo, then in case of morular cleavage at the morula stage, we can see dichorionic and diamniotic cells. If in case the cleavage occurs at the blastocyst stage, then we can see as the chorionicity is already developed at that stage, so there will be monochorionic and diamniotic. If the cleavage occurs at the blastocyst stage, then monochorionic, monoamniotic. If the embryonic disc is also formed and cleavage occurs at that stage, then already the embryo must have been having a chorion and amnion, so they will be conjoined twins. Hazards of monochorionic, monoamniotic twinning: if incomplete duplication of the disc occurs, then this results in conjoined twins. Depending upon the place where the attachment, it is again divided into craniopagus, thoracopagus, types of conjoined twins, pygopagus and cephalothoracopagus. Sometimes there will be acephalic or acardiac fetuses in the monochorionic monozygotic twins due to unequal blood supply or unequal division of the embryonic sac. The fetus which has the other fetus may be having a heart, but it may be depending wholly for the blood supply from the other fetus. Then parasitic twins, if a fetus is completely dependent on the other fetus for everything, then a parasitic twin may be there. Formation of germ cells. Once the blastocyst is formed, the inner cell mass embryoblast and the outer layer flattened cells of trophoblast, the inner cell mass, the free end of the inner cell mass, the cells become cuboidal and they are arranged as a straight line forming the hypoblast towards the blastocele side. Then the cells on the other side may arrange themselves into a straight line with cuboidal cells. These called the epiblast. Formation of bilaminar germ disc happens. The hypoblastic cells, they proliferate and produce a single layer which lines the inner blastocele. So there is a cavity formed primary yolk sac which is lined entirely by the hypoblast layer. Similarly, the epiblast layer may produce the fluid called the amniotic fluid, and the cells arising from the trophoblast, the roof of the amniotic cavity contains amniogenic cells which are produced from the trophoblast. So this amniotic cavity and the primary yolk sac is formed in the 3rd week. Formation of extraembryonic mesoderm or primary mesoderm. The cells from the trophoblast proliferate and they are present in between the yolk sac and the trophoblast surrounding, which is called the extraembryonic mesoderm. There is due to the fluid filling into the extraembryonic mesoderm, there are few lacunae formed in the extraembryonic mesoderm, and these lacunae fuse together to form the extraembryonic coelom. The parietal, once this extraembryonic coelom is formed, the mesoderm is again divided into splanchnopluric, which is surrounding the or present outside the yolk sac, and the cells lining, the mesodermal cells lining the trophoblast are called the somatopluric or parietal extraembryonic mesoderm. This 2-layer formation will result in the membrane formation of the blastocyst. Once the coelom, extraembryonic coelom is formed, the yolk sac size decreases and now it is called as secondary yolk sac. Formation of procaudal plate. The few cells at the caudal end of the, now the bilaminar disc is circular in shape. Few cells from the caudal, from the hypoblast at the caudal end may enlarge in size and form columnar cells. That thickened area is called procaudal plate. Determines the central axis of the cranial, central axis and also the cranial caudal ends of the embryo. This procaudal plate initiates the formation of the primitive streak. At 15th day, the epiblastic cells form an elevation into the amniotic cavity called the primitive node or primitive streak. At starting, the primitive streak is rounded or oval structure present at the towards the amniotic cavity. Once the embryonic disc grows in length, this primitive streak also grows, elongates and forms a groove in between at the caudal end of the primitive disc, bilaminar disc. So procaudal plate is devoid of once the primitive streak is formed, the cells from the primitive streak enter into the downwards medially and away from the primitive streak epiblastic cells, and they displace the hypoblast. So a new endoderm is formed, which is again derivative of the epiblast. The remaining epiblastic cells are called as ectodermal cells. Once these cells which are seeping between these two layers forms the mesoderm. The formation of primitive streak is called gastrulation towards the epiblastic layer. Formation of 3-germ layer. On the 16th day, this cells from the epiblast form the mesoderm. On day 17th, there is a depression at the primitive node, or the primitive pit will have a depression at the center called the primitive pit. Then that depression elongates along the epidermal cells and forms a notochord which elongates cranially. Pre-organogenesis, first 14 days. In this period, if the embryo is subjected to any teratogenic factor, then there is an all or none phenomenon. The embryo will be, it results in the death of the embryo. In the embryonic period, most congenital anomalies are produced due to the teratogenetic activity during this period. In coming to the stem cells, embryonic stem cells, this can be taken from the inner cell mass. They are capable of producing any type of capable of differentiating in any type in the 3 germ layers. Embryonic stem cell therapy, the few diseases of the adulthood like Parkinson's or diabetes or some metabolic disorders can be treated with the embryonic stem cell therapy. Therapeutic stem cell cloning, in few cases the embryonic stem cells are foreign to the patient when we give them. So the nucleus from the patient is taken and inserted into the embryonic stem cell. So the genetic material is similar to the patient for whom we are giving. This is called as therapeutic stem cell cloning. Also, there are adult stem cell from the bone marrow, which are used for the treatment of some diseases. Coming to the notochord, the primitive cells from the primitive streak enter into the few cells develop in between the ectoderm and endoderm and form a rod-shaped structure called the primary notochord. The depression appears in between at the primitive streak called the primitive pit or blastopore. This depression elongates along the length of the notochordal process. Then this is called as notochordal canal. This notochord canal is a rounded structure present above the endoderm. Then gradually the notochord canal opens up and forms a flat plate called the notochord plate, flat cells called the notochord plate, which forms the roof of the yolk sac at the notochord site. This notochord plate, again later on there is a brief connection between the amniotic cavity and the yolk sac at this stage when the blastopore at the notochordal canal stage. Then later on the again the notochord plate is separated from the endodermis and it forms a definitive notochord, rounded solid structure. Most of it disappears at the adult life, and only a part of it persists in the intervertebral disc called the nucleus pulposus, and its cranial continuation as the apical ligament of the axis vertebrae, dens of the axis vertebrae. Formation of neural tube is induced by the notochord. This primitive streak regresses completely on 26th day of development. So few chronological timings where the development events takes place. By 10th week, the major part of the nervous system is developed by the end of the first trimester itself. whole of the nervous system is formed from the surface ectoderm, neuroectoderm, or the part where the neural tube is formed is called neuroectoderm. Neurulation is again divided into pre-somatic stage, the somatic stage, and post-somatic stage. The mesoderm in between is again divided into 3 parts: paraxial mesoderm, intermediate mesoderm, and the lateral plate mesoderm. The paraxial mesoderm again post-otic region forms segmentations called the somites. So the development of embryo is divided into pre-somatic, somatic, and post-somatic stage depending upon the formation of those somites. In the pre-somatic stage, neuroectoderm and neural plate will be developed. Somatic stage, the neural groove and folds, the groove folds on itself. The surface ectodermal cells differentiate into neural crust cells in this stage. Somatic stage, the neural groove becomes a neural tube by the attachment on its lateral, the elevated neural groove margins gets attached. The whole length of the neural tube is not attached at the same time, leaving an anterior caudal or cranial opening and a caudal opening. Opening of the neural tube, then closure of the neuropores takes place anteriorly on 25th day and posteriorly on the 28th day. When this the absence or delay or any abnormality in the closure of these neuropores may lead to neural tube defects. So when we see the cranial end, there is the ectoderm is depressed and forms a neural plate above the notochord. Then this neural plate invaginates, deepens, and forms a neural groove. The cells lying on the margins are called neural folds. These folds elongate and they come in contact with each other at the center and form the neural tube. The neural crust cells are also differentiated from the ectoderm at this stage. The anterior and posterior neural the neural tube on the anterior and posterior, you can see they are not united. Neural crust cells may give rise to many of these neural crust cells are free and they go into the embryo at several places and they form Schwann cells, meninges, endocardial cushions, parafollicular cells, and adrenal medulla, to name a few. The anterior neuropore is closed on 25th day. At this stage, the neural tube forms vesicle, the bulgings or vesicles. There are 3 primary vesicles called the forebrain, midbrain, prosencephalon, mesencephalon, and rhombencephalon. These later on are converted into 5 secondary vesicles. The prosencephalon again divided into telencephalon and diencephalon. The mesencephalon is give rise to the midbrain. Then the rhombencephalon is again divided into metencephalon and myelencephalon. The defect in closure of the neuropore, the anterior neuropore leads to anencephaly. If the posterior neuropore closure is defective, then it leads to spina bifida. In case of spina bifida occulta, the skin over the area, everything will look normal, only the arch, vertebral arches won't fuse together. The spinal cord is open to the exterior surface. If sometimes it is only present as a tuft of hair, this can be diagnosed with imaging studies alone. If the opening is or the defect is more, then the meninges may come herniate through the defect, which causes spina bifida with meningocele. If the in this case the spinal cord is intact. If the spinal cord is also herniates through the meninges, then it is called as spina bifida with meningomyelocele. Sometimes the spinal cord is opened and it is completely in contact with the exterior, which is called spina bifida with myeloschisis. In this case, this is more severe and the babies may die immediately. Subdivisions of the intraembryonic mesoderm. The mesoderm which is present on either side of the notochord or neural tube in the center axis, it is called paraxial mesoderm.